Hi, my name is Marissa Park, registered dental hygienist and birth ambassador. It's February, and you know what this month means for our dental community? No, it's not the chocolates in a few weeks. It is Children's National Dental Health Month. Yay! Each year, the ADA sponsors National Children's Dental Health Month. This month-long National Health Observance brings together thousands of dedicated professionals, healthcare providers, and educators to promote the benefits of good oral health to children, their caregivers, teachers, and more. Developing good habits at an early age and scheduling regular dental checkups helps children to get a good start on a lifetime of healthy teeth and gums. So, what can you do as a parent to celebrate this month? Well, making an appointment at the dentist is one of the best ways to get involved. One of the most common questions we get at the dental office is whether or not parents or caregivers should go into treatment room with the kids. The quick answer is it depends. As a dental hygienist, my goal is to always work with parents so we are on the same team, trying to improve the oral health of their children with a unified approach. So I want to take some time to describe my philosophy in regard to parental presence during dental visits to help the parents in our community understand our approach. For new patient exams and their upcoming well care appointments, we love having parents right next to their children during the visits. Many toddlers even sit on their parents' lap for their appointment. I'm a very visual person and I love showing parents exactly what I'm referring to in their mouths, and we can talk to the parents about brushing at home, diet, habits, and point out any findings we come across as we're working. I love getting to know families as a whole, including parents. So many dental professionals do value this time that we all get to spend together in the office and grow with the family. As the child gets older, we encourage independence. If the child and parents are comfortable with them coming back for the cleanings by themselves. Most kids take great pride in their bravery and feel accomplished when they get through the whole visit on their own. I think I cried a little when my kids didn't need me in a room anymore, and my kids have their own hygienist and dentist. What happens if the child has a cavity or needs any sort of dental work? I'm going to introduce you to my friend, Dr. Milca, who is a practicing pediatric dentist, to share her thoughts on how we can give a child a better dental experience. Hi, everyone. My name is Marissa. I'm going to introduce you to my friend, Dr. Milca. She is a pediatric dentist. I'm going to let her tell you a little bit about herself.
Hi everyone, my name is Dr. Milca and I practice about an hour from Philadelphia, an hour 10, and from Berks County, Pennsylvania, and I finished residency in 2021, and I've been practicing as a pediatric dentist since.
So February is Children's National Dental Month, right? So, this is the first segment that we're sharing with our community. And, it's great to hear from our pediatric dentists. And I have a couple questions that some of our followers might be interested in knowing.
Sounds good. Let's hear them.
So, should parents be in the room during the dental treatment?
So this is a very loaded question. And I would say that it really varies on the provider and also on the parents and also on their practice and kind of the interactions with the patients. I would say that according to the American Academy of Pediatric Dentistry and our guidelines, the team is very important. So who consists on the team? That's the child, the parent, the practitioner, and also their team and staff. So how the team approaches such a question is what's most important. So for some practitioners, they do prefer to have parents absent, but before that happens, there needs to be a lot of trust that's built up. And it also allows the kid to be able to, and the patient to be able to express their needs and concerns without having the parent feel like they need to fill in. So that's one practice modality. Another practice modality, and I've practiced in both situations, and the other practice modality is now my favorite modality, is having parents in the room. Now, each child is different, just like it's hard to say that each child should study the same way and each child should learn the same way or play the same way or be corrected or learn from their parents or be parented the same way. They can't. Every child is different. So it's very important that in my opinion, that the individual needs of the patient are assessed. But overall, I love having parents in the room so that I can show the parents the value in what we're doing. They can hear what we are recommending for the patient. If we're like, oh, we found a little sugar bug in between the teeth, it's really important we floss. Now the parents are saying, oh, okay, I see why this is so important. This is exactly where we weren't brushing or flossing before. This is where the cavity is. So they're able to reinforce that at home. I also like that the parent can then be also a sense of support and someone for them to lean on. But regardless, there has to also be trust leading up to this, because it's very important that the child and the patient is listening to the instructions from the dentist. So that they know exactly what's expected of them, and we can keep them nice and safe and comfortable throughout their appointment. So the parent needs to trust you to be able to do all of that and not feel like they have to interject, because if not, then there's a lot of conversations going on and not enough on the action of getting the kids in and out, because we want to do really good dentistry, but kids have a short attention span sometimes. So we also want to be pretty quick. So there's lots of different ways. There's no right or wrong answer. I've practiced in both settings, and currently my favorite is having parents present. Now there's some kids, like I said, it's not one size fits all. There's some kids that I'll let the parents know, hey, I'd love for you to be in there, but they're having a hard time, and we've tried a couple things. We have different behavior guidance modalities as pediatric dentists. We distract them. We have animal assisted therapy. We do the whole thing. But sometimes I'll say, if things aren't working, I may look at you and do a little wink. And that might mean that you need to step out and just be right outside the door so you can still hear what we're doing, but maybe just knowing that you're not there in a moment may help our behavior. And for some kids, that really does work. And for some kids, they're like, I don't want my mom or dad to come. I said, that's okay too. The biggest thing, regardless of what's decided, is that all members of the team, the parent, the patient, and the practitioner and their team and staff, they all feel confident and able to provide care in that setting.
I mean, I have two kids. One of them has no cavity, and the other one did and stuff. So like, yeah. So when he had to get his first filling, it was crazy. Like I was in the room, he was crying, but
Oh,
I had
no.
to walk away. But after I walked away, he did fine. So it's just really
Yeah,
like I said, the dentist that's treating the child, making them feel comfortable. Because in the end, he got like a free toy, so he was
yeah,
fine and stuff. And he's like, let's go
yeah,
eat ice cream after. So
yeah.
yeah.
Yeah. And I always try to encourage the patients to know that whatever feeling they're feeling in that moment, that's totally okay. And I tell them, before the first day of school, were you nervous? They're like, yeah. I'm like, but then was it fun? They're like, yeah. Like, same thing. It's okay to feel nervous before something that's new or different, but it teaches them kind of how to process those emotions. And those emotions aren't wrong. It's just a learning step.
Okay. So, hey, another thing, like share
Yeah.
one of your wildest story, like trying to help a child improve on their oral health with brushing or flossing. Because, like, the little ones, like as
Yeah.
parents, myself, I'm a hygienist, but at home, I'm
Yeah.
a mom, right? I'm totally
Mhm.
like like I said, both of them are different. One of them loves to brush, the other one doesn't. I'll put the toothbrush on a counter a certain place. If they didn't brush, I know they didn't brush because that's where I
Yeah.
left the toothbrush and stuff. But as
Yeah.
a pediatric dentist, like what is one of like the wildest story that you can share with everyone? Like that happened
Yeah.
maybe in office or anything.
I'd say that like in terms of when we think as adults of brushing and flossing, we picture, the commercials. We picture the sink and the water, and we're just in the bathroom doing all these things. But sometimes with kids, we have to get creative. So I'll tell parents, hey, if brushing needs to happen in the living room, if that's where brushing is most effective, let's do that. Let's have flossing parties where everyone has a little flosser and we're flossing around. And we really just sometimes need to get really creative to help kids brush and floss. Sometimes distraction works a lot. And then also modeling. So if we have older siblings, having show them go first, or them showing the younger siblings how to do it sometimes help. But I feel like the biggest factor that most parents feel shocked by is when I say, just so you know, it doesn't have to happen in the bathroom. I understand it might be a little messy. So hopefully you have some floor situation somewhere in your house where you can do it. But regardless, the benefit of them not having cavities and having nice and healthy oral health is just so important that a little bit of mess, I would argue, is worth it.
Mhm. Well, thank you for all your great insights and everything with kids and stuff. And then we look forward to speaking to you some more and sharing more about your experience and stuff. But we appreciate you. And then if you have anything to share, we love to hear more from you.
Yeah, well, I'm just really excited once I try all of my burst products to be able to talk more about that and kind of give some tips and tricks maybe with these products as well. I guess my last concluding thought is like public service announcement, parents. At age 6, we get our first adult molars. Nothing's gonna fall out. They'll come in through the back and they're gonna be in there. And I always tell the kids, I want them to be in there until they're 100. So around 6, start looking for them, make sure we're flossing because all of our teeth are going to get really close together, and then make sure we're really, really brushing back there because those are really, really important teeth.
Thank you so much.
Yeah, so happy to be here. Wishing everyone happy National Oral Health for Kids.
Dental professionals are trained on how to manage children and parents in any situation. Parents, you should try to play a passive role in managing behavior and focus more on being there for moral support. If you ever have any questions or concern about this topic, please don't hesitate to talk to your dental hygienist or dentist. If you find this video helpful, please give us a like, subscribe to our channel, and learn with us. Happy National Children's Dental Health Month!